Chapter 14, A Lesson Learned the Hard Way. TJ was 23 when we received a call from her social worker. She had had a liver transplant when she was younger, but during her teen years, she was not diligent about taking her anti-rejection medication. We've spoken to many transplant teens who agree that the discipline required regarding when and how often to take their medications can be difficult to stick to, especially if they're feeling fine. It is a very specific regimen from which one cannot stray, and sometimes it's hard for the parents to be the enforcer. So unfortunately, at 23, TJ now needed another liver transplant, and because her liver was failing, she also needed a kidney. Oftentimes, if you have one organ that has been failing for a long time, it can affect another organ. So many patients end up needing to receive 2 different organ transplants, which are generally performed at the same time. Now, TJ had a daughter who was 3 years old and was living with her mom hours away from the transplant center when we were contacted. They didn't have the funds for post-transplant housing near the hospital, nor did they have the time to raise them. TJ's case was special for this reason. Her transplant team wanted to make sure that she was trained and focused on staying healthy and would take her medication, approaching it with the utmost respect. They wanted to make sure that she would be in a situation where she could heal properly and receive her required aftercare at the transplant center and really take it seriously. If she was unable to get housing near the transplant center for 3 months, they were not going to list her. At this point, her life had changed so much since she was a teenager. She was now a mother of a 3-year-old daughter. She understood the consequences of her earlier actions of being inconsistent with her anti-rejection medication, and she was earnest to live and to provide a wonderful life for her daughter. We were happy we were able to get TJ 3 months of post-transplant housing, which enabled her to get listed for a liver and a kidney. She is now doing great, and she has become a wonderful mom and an even better daughter. She returns to her transplant center for her clinic appointments, and her progress has been amazing. She is really grateful to receive a second chance and is taking care of herself well. And we are happy to have been able to help.